tell you it's been a busy 24 hours. I think I laid down to go to sleep at 4 a.m. And we're up doing lines, intubations for patients in the ICU. Usually the patients get sick, they get short of breath, their blood stops carrying oxygen well, they are fatiguing from respiratory distress, and call a rapid, call a rapid response. Everybody comes, nursing, doctors to assess the patient, and at that point, we usually transfer the patient to the ICU. That happened probably 6 or 7 times yesterday. In addition to patients already in the ICU that we intubated, or patients in the ER that we intubated, or a couple of patients that actually arrested, and we had to intubate on the floor while they were doing CPR. So I think one patient decided to be comfort measures and refused to be intubated. So it was busy.
Just can you talk and just really educate us on what that means when it needs to be? Because we're hearing across the country, there's a shortage of ventilators and things of that nature. And so when you have to come in and you and your staff come in, what does that mean ultimately?
Well, typically the thing that people need to do is, well, I'm sorry. So I'm going to start that over.
Mm-hmm.
The fact of the matter is, if your breathing is affected to the point where you need a breathing tube and you need to be ventilated with then the recovery rate is very poor. It tends to be 80%. There tends to be 80% mortality for patients that require intubation.
We're praying for you, as well as all of the other healthcare workers and those individuals who are on the front lines.